One. It's another episode of Social Distancing at the Chamber, also known as Happy Hour with Hammer. Glenn Hammer, our CEO, is joining us from a secret remote location out on the roads of Greater Phoenix today. Glenn, we are pleased to welcome from Arizona Complete Health, their VP of Legislative and Government Affairs, Monica Coury. Monica, thanks for being here.
Oh, I'm delighted to join you. This has just been a great program, so thanks for having me.
Glenn, before I get started with these tough questions that we're going to throw at Monica, say something nice about our special guest.
Well, Monica understands. I'm also talking the policy side of healthcare at the Jedi level, and it's been a treat to work with Monica over the years. She was an integral part of the Medicaid restoration effort that I'll just say today looks better than ever. And, we're just thrilled that she's with us, and we're extremely lucky that she's on our board and is co-chairing our healthcare activities during the toughest period in healthcare in 100 years, probably since the Spanish flu. So thank you, Monica.
Absolutely.
Oh, that's so nice. Thank you, Glenn. Happy to be here.
Spanish flu, for those of you who are watching, came before the establishment of the Medicaid program. So, Monica, before we talk about what's going on in the Medicaid space, I think you should just share with us just an unfortunate anecdote, I suppose, from within your own family. You've had some recent encounters with the healthcare system. What did you find out, and what happened?
Absolutely. I'm happy to be able to report from personal experience that the testing is available, that it's easy to call and get a test. And we, like all of us, right? We're tracking this news. We learn the basics of what the symptoms are. We're not doctors. So we suddenly get a high fever, a dry cough. We have other sore throat, other issues that track right along with what the COVID-19 symptoms are. And it's scary because we're home, we're all doing the right thing, staying home, but we've got healthcare need. So I think really the important thing is that there are telehealth options. I had both of my sons seen via video chat, much like we're doing right now through a Banner Urgent Care. I called, got the app, easy to set up. 2 different doctors saw my children. It was fantastic. Same high touch, same quality, same care taken with the patients. And then I ended up calling one of the Banner drive-through sites and went through orderly, easy, got my test negative. My son, who spiked a 105-degree fever, our pediatrician sent us to the emergency room. Not where you want to be right now, but he got great care at Phoenix Children's Hospital, got a test as well, also negative. So yes, we experienced it firsthand.
Yep. And for those of you who are watching, we are in the midst of a every successive weekend testing blitz. We just completed one. So Monica, you've gone through the drive-through system. It works. You can get it done from the comfort of your car.
Absolutely. And testing, listen, it's uncomfortable a little bit, but it's so important whether you're doing the antibody test on the back end to see if you've had COVID-19 or whether you might be experiencing symptoms and need to know and get that reassurance if you have it. Now, a diagnostic test, the testing helps us get our arms around where this virus is and how we can best move forward so we can recirculate in the world.
Yep. C. Everett Hammer there from his mobile office is not convinced that you guys were truly negative. So he'll weigh in on this, I'm sure.
Well, I'm glad everyone's okay. And the story that you're telling in terms of the ease to get tests to me is very, very important. For now, any Arizonan that feels that he or she may have been exposed or sick. So, to me, we've really turned a corner there, and that's going to be an important element as we re-energize an economy that's been hit very hard.
Yep.
Absolutely.
All right, Monica. You have a lot of experience in what is known as a counter-cyclical program. So when the economy hits a downturn, you're in an area of civic life that gets very busy. So talk to us a little bit about what happens if someone experiences a job loss and perhaps they were getting their health care coverage through that employer. What do they do? What are their options?
Absolutely. You know, we're all looking at what's going on in the economy, what's going on in unemployment. I was sharing with you just earlier, 514,000 new unemployment claims in the state over the past 7 weeks. Your mind is swirling. It's a lot going on, but we want to get the word out to make sure people stay covered with health care coverage. We are in the middle of a global pandemic. We don't want people to be caught without that support. There are a couple of options. The marketplace has multiple health plans that are providing full comprehensive coverage at a very affordable price for individual and family coverage. So if you're finding yourself needing health coverage, healthcare.gov will direct you and give you all of the different options from your area. So there are multiple options across the state. And then the Access or Medicaid program has its own eligibility system as well. You can go to their website or straight to Health E, the letter E, Health E Arizona plus.gov and apply for access coverage there as well. So if you've experienced job loss or income change or some other qualifying event, you can go to healthcare.gov and get that that coverage.
You just used the term, and I just want to go over it one more time, though. This term qualifying event, perhaps it seems obvious, but job loss is a qualifying event that could direct that person into healthcare.gov or maybe the access system.
Exactly, yes. So healthcare.gov, or you can even access that through the Access online system. So yes, if you've experienced a job loss, an income change, or something that perhaps your employer's no longer able to provide health coverage, there are multiple different ways. We didn't have to necessarily open up marketplace enrollment, but there are special qualifying events that will help you get healthcare coverage.
And for those who perhaps have not dealt with the system before, let's talk about the Medicaid side for a second, the Arizona Healthcare Cost Containment System. Arizona's system, we were the last one in the country to enter into the system in the early 80s, weren't we?
Yes, 1982, the last state.
You're the winner of access trivia on this panel. But it is a state and federal program, but Arizona is interesting because we work through private providers or private coverage partners like the company you represent to make sure that Arizonans have coverage.
Yes, absolutely. So one of the reasons we were last to enter the Medicaid program as a state is because we wanted to do it the Arizona way, as Governor Ducey might say today. But we started it through a public-private partnership. And so private health plans provide the coverage and the supports for individuals enrolled in the access system. So when you go online to apply, you get to choose from a list of health plans. The nice thing about that is many of the health plan options are options that perhaps your employer you have through your employer or through the individual or family marketplace. Companies like Arizona Complete Health, United, Blue Cross Blue Shield is also now an access provider, and many others. So there's some continuity there, so you can stay with your health plan if that's worked for you.
Glenn, I know that when you are, and I've had the same experience, when we participate in these national business group meetings and calls, Arizona's reputation for its Medicaid program is one of the nation's best. In fact, by a long shot.
It's the best. It's the best. And, you know, it's been over the years, we've had the best of the best working there. You know, you're certainly part of that. You know, I think in the Betlac years, I mean, we've been very, very lucky, and that's why it's had very strong public support and political support on both sides of the aisle. But yeah, no, this is an area where absolutely people look at Arizona as the model. And Monica, you look better than I deserve when I used to leave Arizona. Now I'm lucky to get out of my neighborhood. But that'll probably change soon, hopefully.
Well, thanks.
Monica, okay, so we've got this on one track for individuals who might have suffered job loss. What do you do if you're a healthcare provider experiencing some sort of distress right now?
Healthcare providers have multiple options right now. So a lot of the payers are working with the providers. For example, in my plan, we stood up a provider resource page on Centene.com. So Arizona Complete Health is a subsidiary of Centene, which is a national company. So we operate in multiple different states. Through that portal, you can get assistance with loan applications, grant applications, access to resources. We've also hosted a series of webinars. So I moderated a webinar recently with one of our national consultants, Hector Barreto, who is the former national director of the Small Business Administration, who's providing us with insight and expertise about how these processes work, how the CARES Act funding is flowing. Also, you all have done a tremendous job on that issue as well to make sure small businesses access PPP and EIDL dollars through the CARES Act. Our physician practices and our healthcare providers are mostly small businesses, just like everybody else. And so there are multiple funding streams right now to help shore up the healthcare sector, from the CARES Act, PPP, and EIDL dollars, all the way to special pots of dollars through the CARES Act and other funding to make sure that we have a strong healthcare sector coming out of this.
Monica, I think if you would have told Arizonans that the healthcare system would be under stress, it would be from the hospitalization standpoint, not that private healthcare providers, because of this elimination of the elective procedures, would be facing so much stress. But that's really what's happening right now.
Yeah, it's really, this has been a surreal pandemic from so many different factors. So what we need to do is make sure that we're investing in our healthcare sector where we need to be, and ensuring that we have viable providers coming out of this process. So we've invested in telehealth as one example. Through Centene, we've put forward $5 million to help our federally qualified health centers stand up telehealth programs, and also provide the support needed to work through how to incorporate telehealth into your regular business model. That's new for a lot of people. When I try to get my kids to connect to their pediatrician when I was sick, they are not up on telehealth. So not everybody has that. A lot of practices do have it, and they're moving ahead. Many don't. So we want to be there to provide that support. Right now, as an example, there's zero co-payments for anybody who's accessing their services through telehealth options. And that's just not COVID related. That's for any service. So if you're getting a sick visit, a well visit, whatever the case might be, there's not any cost sharing liability for members. Most payers are doing that. So we're just trying to be there to provide different avenues. And we have seen an increase in people taking up those options of telehealth. So that's good. And I think that's going to be something that stick with us. What does it look like after we transition out of this situation? Because honestly, we cannot have build up waiting rooms anymore. That's going to be a thing of the past. We have to figure out how to manage through that. And we have to do that together, payers, providers, policymakers, and so on.
You know, when we get on the other side of this pandemic, to the extent that you can get on the other side of it, a lot of things are going to change permanently. Glenn and I have discussed things like What does the morning and evening commute look like? And we were just talking about things like going to the dentist and the eye doctor, sort of routine healthcare maintenance. Maybe one of the positives, though, is the physicians that you work with, they can adopt some practices that'll make their practices run more efficiently.
Absolutely. Let's take our Medicare program, for instance. For our seniors, that's a really important tool to make sure that we're connecting with them, making sure that we can do some well checks, some checkups, some chronic disease management through a lot of these tools, and we can provide the support. We can even just touch base in different ways to make sure we're addressing issues around social isolation. We want to be physically distant, but not isolated. And that's really, really important for a lot of our members. I'll give you a great example that came up with some of our high needs members who have complex care needs. A lot of them were finding that they did not have enough data or minutes on their phones to be able to partake in telehealth services. So we put forward some dollars so that our providers that work with those members could purchase phones and upgrade the phones to have enough data and enough minutes so that we could avoid healthcare crises for those individuals. So things like that, we've got to be thinking differently. We've got to be thinking outside of the box.
Right. Well, this was extremely informative. And Monica, I appreciate you taking the time to walk us through just a few of these innovative things that your company is doing to respond to this moment in time. Glenn, you made it home safely, it appears.
I see. You're parked.
So I apologize that I'm really trying to figure all of this out.
Aren't we all?
Monica, my IT team is in the house right now. It's led by my 15-year-old daughter and my 18-year-old daughter who does support work. I'm sort of hopeless. So
I'm right there with you, Glenn. I mean, absolutely. My kids are doing Zoom meetings for their classrooms and things like this, and so I've had to consult with them, and believe me, they charge.
Glenn, why don't you close us out?
No, Monica, thank you for joining us, and I really appreciated all the aspects of the conversation. But really, the telemedicine comments are really important, because what we're always looking for, I think, as Americans, are what are some of the lessons we could take from difficult situations and use them as we move forward. So I just really appreciate this conversation. And I wish you and your family nothing but good health.
Thank you. And thanks for having me. And same to both of you. Stay healthy, stay safe.
Thanks, Monica.
Thank you.